Welcome to the 497th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Well, I'm surviving past the Rattler 50K. Most of my toenails, however, have not made it. So status report, toes are in not good shape. Actually, my toes are in good shape, but all my toenails are gone. And a little frustrating because I thought I figured out my shoe for my upcoming ultras. And I kind of bragged about it a little bit that I was finally a Hoka girl, and I had colorful shoes and they're really cool to look at. And I turned my back on ultras because the colors weren't that great and they're a little boxy and the Hokas were much more cool and on and on and on. But I didn't see this blister thing coming, and it was a result of blisters underneath my toenails. And on further inspection, the question is whether I had too thick of socks, too short of shoes, wrong shoe, what went wrong. But I think I figured out that when I bend my foot to toe off running, the fabric on the Hoka Speed Goats kind of pushes down into my toenails. Now, I talked to other people, and this doesn't necessarily happen to them, so it is somewhat true to my running form, most likely, and the way my foot is shaped, and again, my running mechanics, but nevertheless, the cloth goes down into my toes, and so light socks would make it less, but wouldn't alleviate it altogether. I put my Ultra Temps on, and it didn't happen. When I toed off, the toe box where my toes are actually came up, so there was lots of room in there. So I'm back to being an ultra girl. So Ultra Temps for ultra running on the trails, and probably Torrens if I was going to road run, but I usually just run in my trail shoes just to keep used to them on the road. So for now, I'm back to being an Ultra Temp girl, and my toes, although they don't have toenails on them, are feeling great, and I'm having no discomfort. Once you get the toenail off and the blister's gone, everything's back to normal. So it'll take me quite some time to regrow my toenails, and I'm going to have to renege on all those foot modeling deals that were thrown my way. Just joking. But nevertheless, I'm all healed up, and I'm running again. So I'm starting to ramp up my mileage with the sights set on the long haul 100. We had a lot of rain with the hurricanes here in Florida, and there's word on the street that the course at Long Haul is still underwater, or a lot of it, so they may actually change locations, waiting to hear from that. But nevertheless, where Andy Kroom puts the course, we will head. Nevertheless, it has been an interesting week with regards to things that have happened, things that I've observed, and tying them all together. And I'll try my best to weave the story of the day that kind of comes down to confidence, resiliency, faith in what you're doing, plant-based nutrition. So those are the key words that I'm going to try to come back to. In the traditional medical model, people are seen, tests are ordered, maybe procedures are performed, and we wait for results, whether it's results from blood tests, results from biopsies, or x-rays, or even if we get results, still may not know the outcome, and we still have to wait. And often our minds go to the worst case scenario. We head to the Google machine, and often the Google machine, we plug in not symptoms, but we plug in the potential diagnoses. And most people jump to the worst case scenario. Cancer biopsy for cancer must be cancer. That's usually the scariest one. People await results. Or abnormal blood test if there's going to be some deterioration of a major organ. We go down the road of, doom fairly quickly. And again, most of the time we put in terms like liver failure or cancer or heart attack, and we come up with things on the Google machine that may support the diagnosis or even may backtrack to the symptoms we have and assume right away that that's the cause of what's going on. And then there's a lot of stress while we wait. And from a physician's perspective, most of the time you don't want to tell somebody they're going to be great and then something bad is going on. So a lot of physicians may give the worst case scenario or not give much encouragement, so it further compounds the stress because the doctor didn't say it was going to be okay, or the doctor said I had 6 months to live, or nobody ever gets better from this, or, so it doesn't help with the stressful situation. A lot of times people are eager to jump to testing because they want a diagnosis, and they want a diagnosis now, and if there's an abnormality, they want a procedure and get it over with and get it done so we can go on. And our emotions start to cloud our judgment, and most of the time we would think differently, but in the heat of the moment, we jump to these conclusions that are the worst case scenario. The alternative could be, what do we know right now? Emergency personnel are taught to look at vital signs to see if someone is stable currently. Do you have a heart rate? Is it in the right range? Are you breathing? Is your color good? Those are all things we can apply to ourselves to see how we are in this very moment before we go down that road of a terrible diagnosis. More often than not, time is on our side, and oftentimes sorts it all out if we can just sit back, take our own pulse, and assess the situation. The other thing that comes to mind to me always is, what can I possibly do to make my situation better? And number one comes into nutrition. Can I make my plant-based nutrition better? If I'm not plant-based, will plant-based nutrition make me better? Most people go down the road of, well, it's over now, so I can just eat what I want because nothing will help. And that couldn't be further from the truth. I talk a lot about mitochondria, those little organelles inside the muscle cells and on other cells of our body that are responsible for generating energy, so taking carbohydrates, fat, and turning them into energy that allows our muscles to contract. But they also have a lot to do with our immune system and our ability to get rid of old cells that may be causing cancer or could cause cancer. But little is known about the ability or how it affects things like arthritis. And a recent study looked into in a review in skeletal muscle diseases and mitochondrial function. And our mitochondria play a vital role in the bone turnover and bone growth with osteoclasts and osteoblasts, or specific bone-type cells. And things like osteoporosis, where our ability to lay down bone is less than what we're destroying bone. So the osteoclast, bone is broken down, but we're not laying down new bones. Degenerative arthritis, where we get bone in places we don't want bones, or destruction of cartilage, destruction of the bone in the joint. Gouty arthritis, which is more of an inflammatory deposition of uric acid crystals. Cancers such as osteosarcoma, which is a cancer of the bone. Autoimmune diseases called ankylosing spondylitis. And it is thought that the mitochondrial dysfunction and the lack of mitochondria play a vital role in the progression of these diseases. Things that decrease inflammation reverse these things. Weight-bearing exercise, good nutrition also help to reverse or prevent these things. But it's not just taking a calcium supplement or a magnesium supplement or a vitamin D supplement. We need to have our mitochondria, because they're what take everything, the proteins, the electrolytes, and process them and ultimately either protect our bones or allow more inflammation to occur, or are responsible for the degeneration of our bones. That's why these diseases occur later in life. We've lost muscle mass, we've lost mitochondria, our nutrition is poor, and one thing leads to another. So you can understand a little bit better why, again, throwing calcium, magnesium, medicines like Fosamax, which decrease osteoclast elimination, don't really change the process, because this degeneration, lack of mitochondria, lack of ability to repair our bodies is going quicker than any medicine can patch up parts of it. So it's just another area where being strong and mobile can aid in the prevention of these things, and so can plant-based nutrition. And, I mentioned gouty arthritis, and sometimes people will call me up and say, I think I have gout, and they don't, or and it's more of an inflammatory arthritis, or they may have something else and they thought they had an injury and they actually do have gout. So I thought I've never talked about gout on the podcast, but typically it resolves around a painful joint, and typically the joint is either the knee, the ankle, typically the big toe, or other places in the foot. But the big toe is much more common, and it is a red, swollen area in the joint that is so painful, and the skin becomes so inflamed that even the covers touching a big toe at night is enough to set people off. It's very, very painful to walk. There's nothing much that temporarily relieves it. And as I said before, it's the accumulation of uric acid crystals into the joint as a result of mitochondrial dysfunction and dietary factors, and some medications that also play a role into accelerate it. So if you have, again, decrease in mitochondrial density or function, and then you add these other things to it, it results in gout in a later life. People that take diuretics because of heart failure or hypertension are more at risk. Being dehydrated puts you more at risk. Alcohol, again, dehydrating, toxin puts you more at risk for the development of gout. And eating meat. Gout has been known as the Henry VIII king's disease, where the kings and royalty had available to them lots of meat and big rich diets, and they would succumb to this gouty arthritis. Gout can be very destructive to the joint if not treated. Most of the time people seek treatment because it's so painful and debilitating. But often the etiology is not assessed, and gout becomes a recurrence for these people. You can measure uric acid levels in the blood, but it often doesn't correlate it. If the uric acids are high, then your risk of getting gout is elevated, but you can actually have gout with a normal uric acid in your blood. Prevention is the best way to go, but if one has gout, it's treated effectively with a variety of different medications. However, some of the medications can have side effects. Colchicine is one of the older medications that probably has the fewest side effects, other than take too much of it, you can get some diarrhea. But it decreases inflammation, it decreases the migration of white blood cells, and it often cures the symptoms in a few days. People have used non-steroidal anti-inflammatory drugs. Again, they have their own set of side effects with increasing risk of heart attack, kidney failure, and GI bleeding. Steroids as well can decrease inflammation, but have their own set of side effects by weakening the bone and weakening your immune system. So prevention's the best treatment of choice. A plant-based diet markedly decreases the risk of gout, even in people that are on diuretics. The biggest meats associated with gout are red meat and seafood, particularly shellfish. So people that say, I only eat fish, you're still at risk for gout and uric acid deposition. It doesn't take much to set people over. So if you're on a diuretic and you have a big steak dinner and a couple of cocktails, it could be the setup for a gout flare. Sometimes just in the setting of people with kidney disease, it doesn't take much at all, just a little bit of something, and the gout can be set off. And then unfortunately, people with bad hearts that are on heavy diuretics, the diuretics in themselves can set an episode of gout on. However, most people with heart failure can limit their diuretic use if they can limit their sodium intake. So most of the reasons for gout can be prevented specifically with a plant-based low-sodium diet. So if you or someone you know has gout, the best way is to prevent it. I heard two stories of resilience this week. One about a doctor who actually has had the onset of Alzheimer's and has been chronicling and actually written a book on his disease and how he has dealt with it and how he is using his diagnosis and course to potentially help others prevent or delay the onset of diabetes. And the other is about a Paralympian that lost sight in both of his eyes by age 7, a diagnosis of a rare cancer, retinoblastoma, in both eyes at age 4, that again, ultimately he lost his eyes at age 7, and how he eventually became a rock climber, a runner, and then a triathlete, even going to the Paralympics. And what a role his father played in have him meet with a mentor that was also blind, and showing him what things had accomplished, and really not accepting that his son would live a life of doom because of the loss of sight. It takes resilience in both of those cases to go on with a pretty heavy diagnosis. And I'm sure there's a lot of people that know other people that have had traumatic events that, again, perception is everyone gets their own, but may not perceivably has been as bad or maybe as bad. And it has destroyed their lives and encompassed their lives so that they couldn't enjoy a full life for whatever time that they had. And I'm sure that you know of people that, again, have made a lot with little time in their lives, and those who have maybe squandered the time that they have. And what exactly is the difference? This particular doctor had a blood test that I've talked about before, looking at the DNA copies of the gene ApoE4. And 2 copies of that gene make you more likely to get the diagnosis of Alzheimer's or dementia. About 9 times the risk with 2 copies, 3 times the risk with 1 copy. Not everybody does early, but the risk is certainly increased. And he has followed his course with a Montreal cognitive assessment, looking at short-term memory, some math skills, some reading, and he's kind of chronicled his decline, so to speak. One of his first symptoms was loss of smell, and he actually kind of traced the symptoms occurred a lot earlier than he realized. One of the things that we know affects the rapidity of the progression of dementia and Alzheimer's is your cognitive reserve. So how much brain power you have, how much of your brain was actively active, affects how quickly that you lose it. So the higher functioning that you are, the slower the disease takes its toll in a lot of people. So instead of being a victim, he took action. And one of the things was starting to walk and exercise more. He had never been an athlete, but running is best. Walking would be second. We've talked about strength training, maintaining leg strength, gluteal strength. Mitochondria, again, helps us to process nutrients. So if you can walk. If you can run, even better. He adopted a Mediterranean diet. I've reviewed Dean Ornish's recent study. If you can adopt a plant-based diet, even better. But eliminating most animal products is key because of some associated virons that might be associated with animal products. This physician had cholesterol most of his adult life, so normalizing lipids the best that you can. There has been no study to date saying low cholesterol is going to change things, but we certainly know that very high cholesterol is not in your best interest. We also know that decreasing inflammation, so not eating animal products, not oxidizing cholesterol, makes the cholesterol less harmful. Eating antioxidants and phytonutrients with fresh fruits and vegetables, key. Being intellectually and socially active, so engaging with other people that tend to be more introverted, staying at home, afraid to go out, things will progress much quicker. And as far as resilience go, becoming socially isolated is probably not good for your resilience and actually living the life that you have left or that you can remember. Lack of sleep is associated with an increased risk or earlier onset of dementia. 7 hours is typically the magic number, but at least rest and not be chronically sleep deprived. Alcohol in large amounts can also increase the risk of Alzheimer's and dementia, but there is a social aspect, so really conclusions cannot be drawn. Again, comes back to quality of life, but certainly inebriation is not in your best interest, nor is medications that are mind-altering. So antidepressants, sleep aids also alter the mind and may increase the risk. And one of the most new things is the vitamin D levels. Vitamin D comes from the sun. Dermatologists have made people sun phobic, so they don't go out. If you think about nursing home patients, they don't see the light of day. But vitamin D is vital for the clearance of amyloid in the brain and the buildup of the tau protein. So whether amyloid is a cause or a result of the development of Alzheimer's is not clear, but certainly we know that its accumulation is associated with Alzheimer's. There was a study looking at 658 elderly adults that were followed for 7 years, and they looked at their vitamin D levels, and they looked at who developed dementia. There were 171 cases of dementia. 102 of those cases were diagnosed as Alzheimer's. They looked at their vitamin D levels being less than 25 as a severe deficiency, being deficient 25 to 50, and greater than 50 being normal. Those people with a vitamin D level less than 50 had a substantial increased risk in the development of Alzheimer's or dementia. It's thought that besides clearance of the amyloid and the tau proteins, vitamin D is also associated with vascular function and the development, or I should say vascular dysfunction. So low vitamin Ds, you have worsening endothelial reactivity, increased risk of ischemic stroke from small vessel disease. Lower vitamin D levels have been associated with the atrophy or shrinkage of the brain and associated cognitive decline. There are vitamin D receptors in the hippocampus and the dentate gyrus, which is a big memory center. There are enzymes that actually synthesize vitamin D in the thinking part of the brain and the cerebral cortex. So we know that vitamin D is essential in brain function. It is associated with growth of neurons and neurotransmitters. It also stimulates macrophages or white blood cells to get rid of abnormal proteins such as amyloid and tau in the brain. Translated, get your vitamin D levels checked. Take vitamin D. I would say almost everybody needs some amount of vitamin D daily because most people don't get outside near enough. I am an advocate of not wearing sunscreen and seeing the light of day as much as possible. Sunlight is your friend. Even if it's sitting out on your porch, but you'd be better off out walking or running to get the vitamin D levels. Up north, it's getting dark, or every place is getting dark earlier, so people don't get out in the evenings. And it's certainly getting cold in the northern hemisphere, so people will have even less vitamin D exposure. So certainly people in the northern hemisphere should be taking vitamin D in the winter months. And finally, all-cause mortality. linked to asymptomatic atherosclerotic burden. I suspect this study will be used to order more carotid ultrasounds and more calcium scores, but nevertheless, I wasn't quite sure what to make of this study. They took 5,716 asymptomatic people, average age 68.9, so 69 years of age. They followed them. This study started in 2008, 2009. They did an original carotid ultrasound and a calcium score. 732 of them had a follow-up ultrasound at some point in the future, and they followed them 13 years. So that would have made people, by the time, about 82 years of age. And basically what the study found, if you had vascular disease, some carotid plaque, calcium score, the bigger the plaque, the bigger the calcium score. In your late 60s, the increased risk of all-cause mortality. The study didn't look at why people died. They just looked at that they died. They didn't look if anybody were on cholesterol medicines or anybody exercised or any plant-based. Just if you have vascular disease, it's not good. They didn't talk about interventions. So my takeaway from the study is, well, it's kind of a no-brainer. If you just grab a bunch of people that are 69 years of age and you flipped a coin, you're probably going to see some carotid plaquing and a calcium score in a fair number. What do you do about it? It's not to do a carotid ultrasound and a calcium score every year or a CT angiogram. It's to change people's risk factors. And so, again, plant-based diet. Prevention is better than trying to reverse something. So when it comes to dementia or atherosclerotic disease, I'll say even cancer, the prevention is your best bet. It's not screening continuously. It's not even doing procedures in asymptomatic people. It is changing your risk factors for the development of the disease in the first place and having confidence that those things actually work, which I believe they do. Our immune system is enhanced by exercise, by vitamin D, by sunlight, by eating plant-based nutrition. If our immune system is enhanced, we're less likely to get infection and cancer. If our mitochondria are intact because we're doing strength training and weight-bearing exercises and we have good muscle mass and good mobility, we're less likely to develop arthritis and diseases of our bones as well as metabolism. You notice I haven't said any pill that addresses any of this. So even if people lose weight, it doesn't address this problem. It's addressed by the side effect of doing plant-based nutrition and exercise, which is the side effect is normalizing body mass index. So the reality, normalizing body mass index, making our bodies healthier is what we're after, not just treating as symptoms of the number on the scale or the cholesterol number or the calcium score number. It's what you're doing to the body as a whole that's going to improve that, will decrease your overall risk. People talk about longevity. There's a doctor that's written books, how to live longer, but why not how to live more resilient? Because does it matter how long you live if you're not very resilient and you sit around and worry about all these potential things that can go wrong every day, that the shoe may fall off and you're not actually living life? This young man that lost his eyesight at age 7 has lived life to the fullest. He enjoys defining or seeing where his boundaries are. And, he takes life by the horns and he lives life. So do most other people that are role models. I had Bob Becker on the podcast a year ago or so. He's the gentleman that did Badwater at 79 last week. He just did Route 66, 140-mile ultra marathon, finished with a smile on his face. We have people in the practice that are doing half marathons and 5Ks in their 80s with a smile on their face, achieving records on rowing machines with a smile on their face. These people are resilient and they're living life. And they're not worried about the future, but they're enjoying today and what can they do to make today better? And where are they actually, and what's the best way to assess that and to keep moving forward? And really the best way to assess it is what is going right today, what went right for you, what are you grateful for today, and what can you put on your plate to make you more healthy, and what can you do exercise-wise to make your body stronger. People that don't have time for those things are the people that are in doctor's office getting repeated testing done because they're worried that something's going wrong and they're hopeful that it's caught early, so perhaps something can be done to them to make them better. But that's not being resilient. I thought that this guy said something profound when he talked about, he didn't know why he got retinoblastoma of his eyes, but what he went through as a child made him more resilient and able to handle other bad things that happened to him as life, things that didn't go his way, or stumbling blocks in life. So each stumbling block makes you more resilient if you choose to have it be more resilient. I did this, so therefore I can do that. We do hard things, translated. I have had the pleasure of having a mother that was very resilient and numerous patients in my practice that were very resilient. And I've seen things happen to them that I thought, man, this is really going to take the wind out of their sails. This is going to be hard for them to come back from. And they take it, they digest it, they make a plan, and they go forward. I was asked, I think I said it in the last podcast, why do you do ultra marathons? Why do you push yourself to become all stiff and sore and lose all your toenails or take risks that you won't be able to finish something? And it's to become more resilient, to learn to be pushed further than I think I can go, so that I'm alive. It's living life to the fullest. It's becoming more resilient and enjoying every day of the journey. I'm an experiment of one on how I want to live my health journey and my life. And so are you. If a guy that's completely blind can do an Ironman and run a 5K in less than 18 minutes, and an 89-year-old woman can run a 10K, and a 79-year-old man can run 140 miles, what are you waiting for? If you want a challenge on how to live life, go to our website, drdulaney.com, DOCTORDULANEY, and we will give you the kickstart to get you going to live a challenging and full life and become more resilient. We'd love to help you with that. We also have our ebook, Addie's ebook, up on the website, 10 great fall recipes to anti-cancer, decrease the inflammation in your plate. And they're really good recipes. You can click on that and get that ebook. I also have a code on the or on the show notes, as always, for water distillers, My Pure Water. Sophie just said the code to get a discount is Clean Water for Sophie. One of the things that has been apparent with the hurricanes here is that our water's been contaminated with runoff. Filters don't take care of that, but water distillers do. So you look into that and some of their research. There are a variety of ways you can join our practice, even if you just want our online content. I encourage you to look and give us a holler if you have questions. You can always email me at jami@drdulaney.com. 500th episode is coming up, so give me an email if you want to be included in a shout-out. I'd love to hear from people that are longtime listeners. It's nice to hear that people have stuck with me for a long time. But I love new listeners as well, so if nothing else, share this podcast with your friends, especially over the holidays, to get more people on your side eating healthy through the holidays. Thanks as always for listening. Talk to you next week.